welcome. Recently, the capital saw the start of a very critical conversation where students, educationists, cancer warriors, government voices, institutions, NGOs, doctors, community health workers came together to discuss cervical cancer and how it can be prevented. The vision of the conclave, Together Against HPV, the fight against cervical cancer, is to eliminate cervical cancer, which ranks as the second most frequent cancer among women in India. Gracing the occasion was Minister of State of Science and Technology Jitendra Singh, who was in conversation with NDTV's Nikunj Garg.
Ladies and gentlemen, it's very rarely that you discuss or the discourse is about public health in such a high-powered forum. And it's our exceptional good fortune to have Dr. Jitendra Singh with us. Dr. Singh, welcome to NDTV.
Yeah, thank you, Nikunj.
Dr. Singh, let me just ask you first, as far as the priorities of the government in the form of public health, particularly in terms of mass vaccination and preventive health care, the Prime Minister himself has spoken, Finance Minister has allocated budgets, etc. As the Minister of Science and Technology, you have also played a crucial role. How do you see this sort of panning out in the coming years and months as we take our journey towards a developed India?
I think what is most important is, and which is not often discussed, that there has been a huge change of mindset, both on the part of the government approach as well as the citizen level, and that is now being recognized even across the world. Now, India is a country which was never taken seriously, never, for preventive healthcare. And leave alone preventive healthcare, even therapeutic healthcare. A country like India coming out with the first DNA vaccine for COVID. And at a time when the entire world was so apprehensive that look here, India with this population of 120 crore would not be able to take care of itself and will become a kind of a very difficult resource pool for the spread of COVID across the world. There's a huge change which has given us confidence and also changed our mindset.
Dr. Singh, now that we are talking about national immunization program, which your government has actually completely, the paradigm has been reimagined. Threats like cervical cancer and the HPV, and on that also government last year announced an initiative. That they are also now becoming an integral part or should be made a part of that?
Data reflects that as much as 90 to 95% women who actually have cervical cancer, if you go back, if you try to elicit their history, they have had a history of having suffered from human papillomavirus infection at one time or the other in their life. So if we are able to target them and prevent the occurrence of this virus infection, we could also contribute to reducing their risk of developing cervical cancer. So I think that's important, and it's affordable, it's accessible, and it has a wider spectrum, it's quadrivalent, and once it's a part of the immunization program, it becomes far more easier for the common citizens also to avail of it. All that it requires is more of awareness, and also reaching out to the people.
One of the problems with this particular disease or this particular challenge of cervical cancer is that there's a lot of taboo associated with it. And that's why a lot of women, particularly in the rural areas, in the Mofussil towns, do not even go for screening. You think more awareness, more platforms like this that we are today looking at NDTV are required to spread that awareness so that more and more women can at least go for screening?
I think that requires a multifarious approach at different levels. As in the context of diabetes, which I deal with, I often say diabetes is too serious to be left to a diabetologist alone. Because you have to have cultural inputs, you have to have social inputs, you have to have also the contribution from the NGOs, and so also is the case over here. Because this, as you said, we have seen parents not disclosing their child being addicted to drugs, and then ultimately themselves having the maximum suffering on themselves itself. So that is one part of it, preparing the masses, the common citizen, to address the issue without having any inhibitions. A, B, reaching out by those who are entrusted with the responsibility of providing this facility. And C, as I said right in the beginning, more and more of preventive mindset, preventive healthcare mindset, which has started happening in India, but it was not happening till just about 10 years back.
You have been a practicing doctor yourself for many, many years. What do you think is the role that the medical community can play in terms of raising the awareness about the vaccines related to diseases like cervical cancer?
No, I'm glad most of the organizations or medicos have now taken upon themselves such kind of activities. For example, among the physicians, we have the Association of Physicians of India, which is one of the largest physicians organization in the world, which is founded by Dr. B.C. Roy himself. Then we have the Indian Medical Association, which was again started during the British times. That's why the headquarters still continue to be in Kolkata. What I'm trying to say is that they have now consciously diverted themselves to the public activities. It's no longer confining only to the academic lectures. We have now categorized public lectures, public seminars separately. And now also there's a closer collaboration with government sector by the private sector. They're no longer working in isolation or working in silos. And the NGOs are also coming forward. So I think there's much of awareness happening across the sections of society, and that is going to create an ecosystem which is already started.
I am very grateful that during the middle of a very busy time, during the middle of a parliament session and regular meetings of the cabinet, you could find time to connect with the NDTV viewers,
Thank you.
with our audience.
Thank you, Nigoy. This is part of our collective responsibility, duty towards the nation. Thank you.
Thank you, sir. Thank you very much.
Also at the conclave, Together Against HPV, the Fight Against Cervical Cancer, was Dr. V.K. Paul, member, Niti Aayog. Joining us today to share insights on India's HPV vaccine rollout strategy, the vision, challenges, opportunities, and next steps in India's fight against cervical cancer, we're joined by Dr. V.K. Paul, member, Niti Aayog. Thank you so much, sir, for joining us today. I think to begin with, as a key architect in India's immunization programs, I want to ask you if you can tell us the status of the HPV vaccine integration into India's national immunization program and what really is planned for the phase of the rollout of the vaccine.
Well, as you're aware, the introduction of HPV vaccine to prevent cancer cervix, the primary prevention of cancer cervix, this commitment was given in the budget speech by the Honorable Finance Minister. The government is working in planning it out. Technical details as well as practical details, practical strategy is being worked out.
Sure. When you say, of course, we know prevention, right? And then it's screening, early diagnosis, treatment, awareness. Do you still think there's a gap? And very often one is aware, one knows they need to go to the doctor, get a checkup, but the action is delayed. How can we bring about that change?
Demand. We should spread the word so that we ask for timely screening and, of course, timely vaccination. That's something that should be known to everybody. And the age at which this should be known and I should feel responsible for is the age after 30 years of age, 30 years, okay? We must also emphasize that once this cancer is detected, it's covered under Pradhan Mantri Jan Arogya Yojana. Ayushman Bharat, PMJ, covers this condition. Cashless treatment of this cancer is mandated.
I think that's a very important point, which again, there's not much awareness about. Niti Aayog clearly works, as a think tank. And we've seen many states have rolled out the vaccine. There's Sikkim, there's Bihar. But if I can ask you as a strategy, because that's what we're talking about, any lessons that you would like to share which some states have done, not just vaccination, but just generally where prevention, how they're dealing with cervical cancer?
States have demonstrated, let's say, two things. One, that it is possible to scale up HPV vaccine in a systematic, safe manner, but more importantly, they have also surmounted and found ways of addressing the concerns that come up when such a strategy, is truly rolled out, because people have questions, people have misconceptions. At times there is misinformation, infodemic that we've experienced from time to time. So the states have learned, how to technically and for execution, they found the pathways to do it. So the learnings are available in that aspect. But more importantly, when you do it, we should not succumb to undue concerns which do not exist. We should be clear about the, quote unquote, side effects, if any. And also, we should have confidence in the minds of people that this is something for their good,
Yes.
this is trustworthy, this is based on science, it is safe, and it is in the larger interest of the people.
There can never be one size fits approach, especially in a country like ours. How does one create community-based approaches to reach our diverse populations, whether it's a geographical location, cultural, socio-economic? I mean, we have a lot of that in our country.
The nation runs the biggest immunization program in the world. And we could, scale up the COVID-19 vaccination program of 220 crore doses because we had the learnings and the foundation and the fabric of universal immunization program. Time has come that we use those capabilities, that experience, that strength, and then take it to scale, both from vaccination point of view as well as screening point of view. But we also not forget that we have a huge base of producing vaccines.
Yes.
We are
we've seen that.
the vaccine maker of the world,
Yes.
for the world. And therefore, we are in a very unique position of having access to vaccines, our own vaccines, all the way, end-to-end treatment of most of our women who would harbor this disease. And therefore, when all these things have come in place, as society, all stakeholders, media included, should come together
Yes.
to act on all the points.
I think that's really well put. Everybody needs to come together, work together, all the stakeholders in this fight against cervical cancer. You spoke about the ASHA workers. They've been with us. They've been interacting. They've been telling how they've been trained. It's really a pleasure to have you with us on NDTV. Thank you so much for joining us.
Thank you. Honor to be here. Thank you.
The first of the discussions was an overview of why the burden of cervical cancer is so high in our country, India, and what can be done to reduce it.
When we talk about the burden that cervical cancer has on our society, Dr. Tang, I'd like to start with you. And we have the preventive means, we have the vaccines, we have the screening, it can be dealt with, but why is the burden so high then in our country?
Well, in a word, I would say the burden is very high because we are not availing the full benefit of what is already available to us. It's multifactorial. It has to do with the fact that there is a certain amount of vaccine hesitancy, there is a lack of awareness, and I always say this, that there is too much concentration on side effects rather than effects. When you talk about vaccines, unfortunately, the conversation seems to revolve around the potential problems with the vaccine rather than the massive benefits which accrue from vaccination. And I think as a community, and I'm not really talking about doctors alone over here, I'm talking about as a community of doctors, advocates, policymakers, we perhaps failed in a way to drive the narrative in a way which ensures that people are more accepting of the way the vaccine is given, and perhaps have failed to create a demand in a way for the vaccine. So you remember COVID, I'm sure all of us remember COVID.
How can we forget?
We were so eagerly waiting for that vaccine,
yes,
right? So we have in a way failed to create that demand within the community and tried to, raise the awareness in a way in which a girl, so let's say for example, if we could pitch a campaign to say that the best birthday present you could give at 10 or 11 years of age is the HPV vaccine. We haven't really done things like this to raise awareness at a community level, and perhaps that is one reason why we have this burden. The second reason, of course, is also the gaps we have in our healthcare structure, both in terms of human resource as well as capacity in infrastructure. We need to urgently fill these gaps, but I think it all begins with vaccination. Because if you prevent it in the first place, then you perhaps will have a reduced need of all of this thing going down the line. There is also the problem of screening, and in a way the taboo which surrounds the topic of cervical cancer vaccine. I suppose in a way it's because, in a way, it's associated with sex.
We will be speaking, to the Health Minister of Sikkim. We'll also be speaking to the Health Minister of Bihar. But how do we get other states also to include this vaccine as a part of their immunization program? And, we spoke about the COVID drive. How do we do this kind of a drive for this vaccine?
Yeah. So, a lot of important points have been made. One of the key things which is emerging is in terms of creating awareness. And I think unless the government steps in, things are likely to be slow. It is important because if a demand is to be created, simultaneously the product has to be available, the supplies have to be available. So that mismatch should not be occurring. So if we are not just talking about private market, we are talking about everybody. And therefore, this whole issue to come up in the National Routine Immunization Program is critical. Although the government did talk about that they will encourage and facilitate immunization against HPV, but we do not have a very clear direction coming up, policy direction, that as and when the vaccine will be available. But as far as I understand, one of the major bottleneck at the moment is the availability of adequate supply so that it can come in public health. I just told you the requirement. We have an annual birth cohort of girls which is equivalent to 13 million. 1.3, 1.5 crore children are there in every girls. So that is something which is very important. And then if we have to catch up do a catch up, then we have those huge number accordingly. And which I mentioned that even if I go one third, we require huge amount. The second important which is coming up, and I would request those who can afford, that the boys in the family should also be immunized. A gender neutral approach is very necessary. At the moment, our country and a lot of other low and middle income countries are not going in, not so much for finance, it is the non-availability of the vaccine. But a gender neutral approach will take care of a lot of this stigma issue. कि खाली लड़कियों को मिल रहा है, why not boys? लड़कों को क्यों नहीं दे रहे? And the key issue is that it is a sexually transmitted disease. उसकी जगह if we say कि ये कैंसर से बचाव की है, and which Dr. Tank was very rightly mentioning, I think that's a very important point because a lot of communities have this pushback if you start talking about sexual transmission of this. Another very important point is that I wanted to say this, and that is another, that when we talk about sexually transmitted, and I'm sure the gynecologists must have come across, many husbands throw away their wives if they come to know if she has a cervical cancer, because they think it's a sexually acquired disease, rather than understanding that they are the contributor to that. So, इस सारे के लिए this gender neutral approach is very necessary, but the first approach, because of the limited available of vaccine, we shall be moving for girls only, but those who can afford, I think boys should also be given so that it takes care of. But the key at the back of the whole thing is that unless this program comes in national program, I think movement will remain slow.
The next conversation centered around awareness and education and how they lead to action which is indispensable to elimination of cervical cancer. To translate awareness into action, messaging must be simplified, misconceptions addressed, and accessible resources provided. So in this panel, we focus on how awareness and education leads to action, which is indispensable to elimination. So I think, to begin with, I would like to just ask you about awareness. How do you sensitize them about something so crucial, whether it's vaccination or spreading awareness?
The physician, the treating physician will have to spend time, that one-to-one connect with the parent and the child is must. For that, the important thing is that we'll have to build a relationship, first of all, and then telling about the facts about the vaccine. When we talk about HPV, then that disease is not happening to the adolescent or teen at that very point of time. But when you will tell about the importance of prevention or vaccination at this point of time, and thereby preventing the disease during adulthood, for that the important aspect is that we'll have to tell the facts, what are the facts, what are the numbers, and how does immunizing children at a particular age is much better than immunizing them later. Then aware about the value of investing at this point of time by vaccinating the child or the team at this point of time, thereby having the good revenues subsequently when the teen grows up. So this is one very important thing. Second thing is to have a trust on us. How? Telling them our own stories, telling them that, okay, our children has also received it. So one is that you will have to tell the facts and figure. Another thing is that you will have to tell them that, okay, this particular disease is really life-threatening.
Yes.
And not at the older age, but even in the young age group also they can suffer. Not only why this is important, but how it is going to help in reducing the healthcare burden, the cost, when we are talking about the disease which is happening at the later age group. Then what is the cost which is going to incur? Not only the cost for the individual family, but also cost for the whole society.
Yeah, so more of a preventive approach
Absolutely,
right
from the beginning, this is important.
So now,
Yes.
Mritu, if I could just come to you, we've heard, from the doctor's perspective, from a school perspective, as an educational institute, you're doing a lot of work on ground. What solution do you think would be sustainable when it comes to awareness? Because that really is the need of the hour for cervical cancer.
There's no one solution for what would work, but when we have gatherings like this, everybody here is from the fraternity. So you have this very knowledgeable discussion about cervical cancer or the vaccine. But if you go into community, it could even be a corporate office. Nobody will know about cervical cancer. There will be nobody who will raise their hands. Nobody would be vaccinated, or less than 1% people would be vaccinated. So the fact is that we need to create more conversation around cervical cancer to even get started. We might have it available at the doctors' clinics. The government might be able to source their 30 million vaccines. But who is coming to take those vaccines? The doctor can only give you awareness if the woman comes to the doctor's office. So how do we get people to the doctor's office? How do we get them to hear that? That is the challenge. And in India, we have to contextualize. We've learned from global practices and we know what works, and there are lots of countries doing it. But in India, aaj bhi, oral, word of mouth is how information passes. So that messaging needs to be standard, that HPV vaccine is cancer prevention. It prevents against 6 types of cancers. We are starting with girls because the cervical cancer burden is high. Cervical cancer vaccine is safe and effective.
Simple
Enough
messaging,
information
but effective
that much.
messaging, yeah.
That is enough information for her. Now the challenge here is that the vaccine is for from 9 to 14, right? If it was like the polio vaccine and the child was below 5, they would be coming to the doctor anyway. Or फिर you don't have a choice. तुम्हें वो देना ही है. Polio drops हम कितनी देते थे अपने बच्चों को. Every time you go to the doctor, they give you polio drops. And then the ASHA worker will come and give you polio drops at home if your child is below 5, right? वो नहीं होगा इसमें. And the child is 9 and above. So does the child go to a pediatrician? Does the child go and see a gynecologist? Will the child be going to a doctor at that age at all? Vaccines तो खत्म हो जाते हैं by the time they are 5 or 9. So there are lots of challenges. Let's not underestimate the challenge of this vaccine's uptake.
Yeah.
We want to save girls, right? We lose one woman, we say, every 8 minutes. It's not just a statistic, it's a woman's life. By the time I finish speaking this, we would have lost one woman somewhere.
True.
So who's going to make decisions for her? How do we save her life? So we need to all work together. Like we've said so many times, collaboration.
Yes, it has to be together.
Standard messaging and getting it to the right people.
Thank you all so much for coming and sharing your expertise as well as your stories. So it's very clear that awareness is indispensable to elimination of cervical cancer, because only when people are aware will they act. Thank you all so much. Every 8 minutes, a woman in India loses her life to cervical cancer. A devastating reality, but one that is preventable. To combat this, a collective effort is crucial, involving governments, healthcare providers, community leaders, private organizations, and individuals. For more insights on eliminating cervical cancer, including conversations with state health ministers and experts, tune in next week for another episode from our conclave, Together Against HPV, the fight against cervical cancer.